Yes. Now discuss about the mid-palmar space of hand. This is clinically important space. It is situated on the medial half of the hollow of the palm. In this diagram, you can see here is this is distal palmar crease. This is distal palmar crease. This is distal palmar crease, and here is this is flexor retinaculum, and here is position of the lumbrical canal. This is lumbrical canal. Here is web space. This is lumbrical canal. This canal is known as lumbrical canal. This mid-palmar space is triangular in shape, present on the medial half of the hollow of the palm, and it extends from vertically. It extends from distal palmar crease to this is distal palmar crease from here this is distal palmar crease from here to distal margin of flexor retinaculum. This is flexor retinaculum. So this is mid-palmar space. If you got a transverse section at this level, you will find here is fifth metacarpal, here is fourth metacarpal, here is third metacarpal, here is second metacarpal, here is first metacarpal. This is first metacarpal. Here are hypothenar muscle, and here thenar muscle. These are thenar muscle, and here is hypothenar muscle. This is fourth dorsal interossei, this is third, this is second, and this is first dorsal interossei. This is dorsal interossei. This is dorsal interossei. Dorsal interossei. Here are palmar interossei. This is first, second, third, and fourth palmar interossei. These are palmar interossei. First, second, third, fourth palmar interossei. This is adductor hallucis. This muscle is adductor hallucis. Sorry. Adductor pollicis. This is adductor pollicis. This is adductor pollicis. Adductor pollicis. This was adductor pollicis. Here is fascia covering this. This is fascia covering the thenar muscle, covering the hypothenar muscle. This is fascia. There is skin. And this is palmar aponeurosis. Here is palmar aponeurosis. From here to here, this is medial palmar septum. This is medial palmar septum. This is medial palmar septum. Here is lateral palmar. This is lateral palmar septum. This is lateral palmar septum. And here is intermediate palmar septum. This is intermediate palmar septum. This is intermediate palmar septum. This is intermediate palmar septum. And here is fascia covering these muscles. Here is fascia covering this muscle. Here these are Flexor, Digitorum, Superficialis tendons. Here are Flexor, Digitorum, Profundus tendon. Flexor, Digitorum, Profundus tendons gives origin to lumbrical muscle. Here is first lumbrical, here is second lumbrical, this is third lumbrical, here is fourth lumbrical. And here is position of tendon of Flexor pollicis longus. This is Flexor pollicis longus tendon. So from here to here, this area, this is mid-palmar space, and this area is thenar space. So now we'll discuss about this space, that is mid-palmar space. Actually, space is present here. Space is here. This area is space. This is anterior boundary, and these structures form posterior boundary of this space. So space is here, this area. This is mid-palmar space. So extension is here. It extended from distal margin of flexor retinaculum to distal palmar crease, and it communicates proximally with this space of perona, and distally it communicates with the lumbrical canals. These are extension and communication. Now boundary of this mid-palmar space, this space. Anteriorly it is bounded by these structures. This is palmar aponeurosis. This is palmar aponeurosis. This is palmar aponeurosis. Then Long flexor tendon of, this is middle finger, this is ring finger, for the middle finger, for ring finger, and for little finger. These are flexor digitorum superficialis, flexor digitorum profundus, and second, third, fourth lumbricals. So these structures form the anterior boundary, and these structures form posterior boundary. So posterior boundary is formed by third and fourth dorsal interossei, third and fourth palmar interossei, and fascia covering this. It is medially bounded by this septum, that is medial palmar septum, and laterally it is bounded by this intermediate septum. This is intermediate septum. So these are boundary of this mid palmar space, this space. And if this infected, this space is infected, then pus can be drained by making incision over this space. These are third or fourth baby space. So this is all about the mid palmar space.